Good morning, good evening, and good afternoon. I think we have people from around the world. It looks like we have around 12 people right now, and I'll wait maybe just a little while longer, maybe 2 more minutes. I think I'll give time for a few more people to join, but I'll go ahead and tell you if this is your first time using GoToWebinar. My name is Tristan Phillips. We'd really, right now, I think everyone automatically is muted to begin with. If you can raise your hand, there's a little hand button to ask a question. And in that case, I will unmute you. Here, we have a question here. Mizahu, is that right? Did you have a question? All right, maybe you didn't have a question. But so that hand button is how you can become unmuted to ask a question. And then you can also just type something in the chat or pose a question to me. And I try to keep all these windows open so that I can see what you guys are, whether you have any questions or not. All right, so we will begin in just about 2 minutes. We have one question, and it is, well, will you leave the slides and video on the website? Yes, absolutely. On the Gateway to Global Aging, we will have both the slides and the video from today's webinar available on the website. All right, we'll begin in about 1 minute. All right, so let's begin. This is an introduction to Gateway of Global Aging Data, and we wanted to be able to give people who are interested in using our website more information about the website before, if you aren't able to attend. Sometimes we have in-person workshops. So this is to give you a little bit more information. We are operated out of USC, the University of Southern California, and in particular out of CSER, the Center for Economic and Social Research. All right, and let me know if anyone is not seeing the slides or is not able to hear me well, and I can make sure to speak up. So I'm going to do a brief overview of health and retirement studies around the world, which is really what our website is kind of focused on. So starting in 1992, the National Health Survey, or the Health and Retirement Study in the HRS started, and that's a nationally representative survey of Americans over the age of 50 and their spouses. And the HRS has been this great resource. It is longitudinal, as are all of these studies. So the idea, if you're not familiar with longitudinal surveys, is that someone is asked a certain set of questions, and then they are asked that question again at a following wave, and usually following the convention of the HRS, that's every 2 years. So a participant is re-interviewed 2 years later, and most of these studies try to follow people from pre-retirement. So the beginning age differs a little bit. The HRS is 50, age of 50, who is over 50, so it starts at 51 through the end of life, and then at the end of life, the next wave is an exit interview, which is conducted with a next of kin or the most knowledgeable person. But after the HRS started, a whole host of other surveys also started. So those include the Mexican Health and Aging Study, which was started in 2001, and there was a re-interview in 2003. And they took a break and they started to recollect in 2012 was their third wave, and they're having a fourth wave shortly. The English Longitudinal Study of Aging, ELSA, was started in 2002. In 2004, SHARE started, which is the Survey of Health, Aging, and Retirement in Europe. It's a longitudinal, multi-country survey of people 50 and older and their spouses. Currently, it's in 19 countries and Israel. And beginning in 2004, they started with a smaller set of countries, and then every year they've added more countries to be part of the SHARE study. The Korean Longitudinal Study on Aging started in 2006. The Indonesian Family Life Survey, or IFLS, started actually in 1993, but in 2007, or 2007 wave, it became comparable to the HRS. So they had a cohort that asked questions very similar to the health and retirement study in the HRS, which makes it comparable. The Japanese study of aging and retirement, JSTAR, was started in 2007. The study of global aging and adult health, which is SAGE, which is conducted by the World Health Organization. Their first wave was conducted between 2007 and 2010, and they are still in the field right now for their second wave. That is age 50 and over, and the share countries are China, Ghana, India, Mexico, the Russian Federation, and South Africa. So it's quite nice. You get a little more kind of geographic diversity than you do in some of those other studies. These are the only way to get African data is using SAGE currently. The Irish Longitudinal Study of Aging, TILDA, is a nationally representative panel survey of people aged 50 and older and their spouses in Ireland, started in 2010. Corellis, or the Costa Rican Longevity and Healthy Aging Study, was started in 2005, and they had 4 waves. And the second cohort, which was 2010 and 2012, are the most comparable to the HRS. The China Health and Retirement Study, CHARLES, is a biannual national representative survey of Chinese people aged 45 or older in this case. It was started in 2011. And LASSI, which is our kind of latest study to be added, where the data is available. There are other studies that are coming online, but LASSI is a national representative panel survey of Indians aged 45 or older. And the pilot study was conducted in 4 states in 2012, and the baseline is planned for this year. And the baseline sample is not only representative of India as a whole, but each of the states individually is representative. So we're quite excited about having LASSI data available. So all of these studies share things in particular. And one of those things is that they're all funded by the National Institute of Aging, which is one of the National Institutes of Health, funded by the US government. And so all of these studies are all the data is freely available to be able to use for research. So that was one of the conditions of having funding from the NIA. Another one of those was that there is some core content that we're measuring the same things across different countries, because we really want to be able to compare this between different countries. So some of these core content areas include health, cognition, diseases, emotion, injury, physical functioning, that's ADLs and IADLs, physical measures, health behaviors. These also include some measures that are physical measures which are measured, like height and weight. We'll talk about those shortly. They also include health insurance, healthcare utilization, healthcare expenditures, such things as out-of-pocket spending, what people spend on prescriptions or co-pays. And they also include a lot of labor force, employment status, history, earnings, disability, work characteristics, pensions, when someone retires, at what age, if they have not retired, when do they plan to retire, when do they consider themselves to have retired, and then economic status. So economists often use these set of data sets because there's really a wealth of economic data. So those include things like consumption, earnings, government transfers, housing, non-financial assets. And then there's also a set of questions which usually focus on some of the kind of social things that might be going on in someone's life. So those include things like family structure, how often people, how many living children they have, whether their parents are living, how often they engage with those family members, how often they engage with friends or their community, whether they volunteer or go to religious ceremonies frequently. Family exchange. So in some of these surveys, it's very important the money that is transferred between different generations. So that's try to be captured. And then marriage and social participation. And some of the key innovations were enhancing the quality of economic data. So there's a large problem of non-response bias, which is that there's different types of non-response bias, but that can either mean that someone doesn't participate, chooses not to participate in the survey, or that they participate in the survey and that they leave a certain item missing. And this is very true of economic data. So a lot of people, if you ask them maybe a question of how much you have in a certain account, how much do you have in your pension, or how much will your pension pay when it starts to be paid to you, people won't know. They just don't know that answer. And so one of the innovations of this HRS family, this health and retirement family of surveys, is unfolding bracket questions, which kind of narrow down the band if someone is the band of possible values if the participant is unsure. And then also imputation, so that in those cases where we don't know, we'll actually impute these values, so that if you use them in your analysis, you don't have to drop these people because they have missing values. And it's also integrating biomarkers into social surveys, which is really why these data sets are so fantastic. So these include physical measures, blood measures, and genetics. So these physical measures include height, weight, waist or hip circumference, blood pressure, grip strength, lung function, which is sometimes called a puff test, gait speed, a timed walk, and balance. And then some of the studies, not all of them, also collect blood. And it's done in a little bit different ways in different studies, which is important if you're interested in using some of these markers like cholesterol, some of these measures. So for instance, whole blood is collected by ELSA, so England, Tilda, Ireland, Charles, China, and IMHAS, Mexico. Dried blood spots are collected by the HRS in the US and India through LASI, just Germany through the SHARE survey, and IFLS in Indonesia. And then some of the studies currently have not collected any blood, and those include CLOSA in Korea, the rest of the SHARE countries besides Germany, and JSTAR in Japan. And they also include, they're starting to include, a really exciting kind of emerging area in science, which is genetic data. And currently just 2 studies have genetic data available, and that's the HRS, and they collected a saliva sample, and they've done a full GWAS on that, if you're familiar with genetic analysis. And then ELSA also has done a full GWAS using whole blood samples. And both of these, for the genetic and some of the blood measures, I will say it takes a little bit more work. There's a higher level of scrutiny to get access to the data, but those are both available. So one of the things that we've done as part of this project is we have developed a set of working papers to look at specific domains for cross-country comparison. So the current ones that we have available are chronic medical conditions, financial transfers, expectations, employment and retirement, income, wealth, cognition, and health behavior. And so these are provided to give you an idea. Say you're interested in looking at cognition, so you could go to this cognition working paper and see how cognition is compared between all these different surveys. And truly everything that I'll talk about today, kind of the end goal is to take these different surveys in different countries with sometimes very same questions, sometimes different questions, and to be able to say what's comparable. How can I compare the aging or the retirement process between these 2 different countries, and what can I learn? What are the effects of environment and policy and behavior and culture? So mostly today we're going to talk about the Gateway to Global Aging data, which is a web tool that we have developed. And you can visit the Gateway to Global Aging data at www.g2aging.org. And here is our website. Make that a little bigger for everyone. So this is what you'll see if you go to our website. Again, everything provided on our website is free of charge. So you can use that as anytime. It looks like Deidre might have a question. Deidre, I'm going to unmute you quickly just to see if you had a question. I see your hand was raised. Deidre, did you have a question? Okay. All right, so maybe not. Again, you can raise your hand to ask a question, or you can ask your question through the questions or through the chat, and I will try to be watching all those windows, certainly. All right, and so we're going to kind of walk through the Gateway to Global Aging Data and what is available to you, how it might be helpful for your research goals or interests. The Gateway to Global Aging Data includes a digital library of survey content, illustrative flowcharts showing skip pattern, survey concordance with intelligent search engine to locate relevant survey items, interactive graphs and charts. We include integration with Stata so that you can match those survey items, the survey question you might be interested in, to the variable in the data set that you might actually download from the survey. Harmonized data files for cross-country analysis. We'll spend a good deal of time talking about that. And then recently we have added a searchable library of publications based on health and retirement surveys, which we're pretty excited about and we'll also talk about. So let's talk about, when I say survey metadata, what I mean. So survey metadata provide detailed information about all the parts of the survey without providing the actual survey microdata. When I say survey microdata, I basically mean the data set that you would download, which would have the respondents' answers to the questions. So that would be like a yes or no to a question of, do you smoke right now? But when I talk about survey metadata, which is what is cataloged in our Gateway to Global Aging Data, so that includes the location of all survey items inside the interview. So as you'll see, surveys are usually divided into modules, and then inside of a module you'll have many different questions, some at the beginning and end, and so that location is important to remember. Also, the module, not all modules are asked to all respondents. So that's also important to remember. It also includes survey questions, meaning the text, whether there were any interviewer prompts, and their answer types and choices, right? So if it's a multiple choice answer, which usually these are, instead of string answers because those have to be recoded by someone. So what the interviewer asked and what how the respondent was allowed to answer. So how the question was asked and to whom, what respondent was asked that question, whether every respondent was asked that question, or just say the family respondent or the financial respondent. Links to microdata variables and how those values are formatted. So for instance, for a smoking question, again, we'll look at this, but for a smoking question, we would say this, for IFLS, inside of the IFLS data set, this smoking question, that information is stored in variable name blank, and we'll let you know that inside of the IFLS data set, that 1 that you might see in the data set means yes, and the 0 means no, or the 1 or the 5, or however these data sets, different values are used for things like yes and no. We also have assigned research topics, keywords, and domains to make them more searchable. And we suggest similar survey items based on some cart matching, and user notes. Well, we allow you to make a note, which is reviewed if you feel like you have something helpful to add. So let's take a look at what that would look like. So going back to our website here. All right. So the kind of easiest way to look at survey microdata is the surveys at a glance, and that'll give you an idea of everything that's currently available. We have this table here, which shows you all the studies which we currently include. We're always looking to add more studies and are in that process. And the nice thing about this table is it also lets you know when these studies began, because they don't all begin at the same time, and so that can be important. All right, so I'll also just briefly mention we also on this page have a study overview tab. This is for the core interview. We have the study overview tab, which also gives you an idea of if you just kind of want a brief overview of what were all the studies, where were they conducted, at what age did they start, how they were conducted, so whether in person or by phone or a self-completion, which is a take-home, survey, the number of waves currently collected, whether they've refreshed their sample, and then some more general information about like what is their sample size, how many deceased people are recorded if you're interested in looking at end of life in particular, and whether they what type of blood-based biomarkers they have collected if they have collected those. And we also have a couple more tabs here for self-completion, life history surveys, health assessments, exit interviews, and community survey, which is currently just asked in Charles. But core interview is probably what you're looking for kind of the most typical survey measures. So you can see here for the HRS, so let's just jump into one of these. So let's look at SHARE, which is that European survey. We can go into their Wave 2, which we can see was conducted in 2006. And then you can see these are all the modules, the survey modules that were asked inside of the SHARE Wave 2 in 2006. We can jump into any one of these. We can go to behavioral risk, and then we can look at any one of these survey items. So you can see at first, we have some survey items which are just ID variables. This is a system-generated variable. And then we have some which are constructed variables, and then the rest of these are probably going to be just Q. So these are questions that are asked, and you have a brief description here. So we're saying this is a question of ever smoke daily. So that's our first kind of question asked. So this gives you kind of the base view of the survey data that was the survey metadata, which we have recorded. So we know that it's a question. The question text was, the following questions, there's a prompt, are about smoking and drinking alcoholic beverages. Have you ever smoked cigarettes, cigars, cigarillos, or a pipe daily for a period of at least 1 year? We let you know that they were given enumerated answer types. The answer choices are a yes or a no, which makes sense in this case. And those numbers before that actually record how those are recorded in the data set. We let you know that this item is used in a harmonized survey, and we will talk about that a little later. So this is the associated variable. So BR001 underscore is the name of the variable inside of the shared data set, which would contain the answers to this question. And it makes a lot of sense in this case for share, because the question is BR001 and the associated variable is BR001 underscore. That's very simple to figure out. It is not as simple for all surveys. So this associated variable is actually quite helpful for people. You can locate this in a flowchart, which we'll show in a minute. And we also have assigned the topic smoking and tobacco, which will be helpful for our search, which I'll show you shortly. And we also say this is the concurrent item, which means that, of course, this question was also asked in the wave before. And so we have a link here directly to that question that was asked way before. And this can be especially helpful to identify any changes which happened between waves in a question. And then researchers were also interested in. So it looks like maybe someone was using our website who was looking at smoking and reading skills, which is interesting. So we also have a survey concordance. And so this is that search that I was talking about. So users can identify comparable survey items between all health and retirement surveys using keyword search, top-level research domains, top-level or finer research topics for harmonized studies. And we allow users to find comparable measures between multiple waves of one study and the same year in multiple studies. And so let's just look at an example of what that looks like if we jump back to the website. So this is a concordance across surveys here. So you can see we have just a blank search box, which we could use. We could say just type in something like height, and then we could say I'm interested in height in Charles. You can also see that once you click on a survey, the years available changes, and we just try to indicate to you what's available for each study. So I could say I'm interested in looking at height in Charles in their wave that was conducted in 2008, and I can search for that. You can see we've got a bunch of different height variables here, which are all in the Charles pilot, because that was their 2008, in their biomarker module. And you could jump directly into either the module level, the survey level, or any of the items directly to find out what's a little bit different about all these different height measures. If we go back, we can look through a couple more examples. I'll show you an example. Let's see here's an example. We can use type in health in general, and we're going to look at this for share and share 2004. So we can search that, and you can see we get a bunch of these health in general questions, version 1 and 2, both for share 2004. And if we go back, so that's kind of how you can do a string search. You can also do a search using any, for these top level domains, any of these boxes. So you could, for instance, click here on ELSA. We could say ELSA 2004. We could do 2 years. Say we're interested over 2 years, 2004, 2006. And then we could pull up all the cognition questions. So we can do that and come down here and click search. So these are all the cognition questions. So there's 54 total cognition questions that were asked between 2004 and 2006. And you could jump into any one of those. Let's go back to that one that we looked at before, because this will bring us to our flowchart. So let's go, again, let's type health in general, and let's select share and 2004. So let's search that. Yeah, so we get this health in general question. And we can just go to, it looks like these first ones are all asked in the physical health module. So let's just jump to that module, because sometimes that's an easy way to look at this. And we have a couple different ways for you to look at modules. So we have this item view, which we've seen, which just goes through, you can see all the items included in this module. So it looks like there's 56 different questions here. We also have a codebook view, which if you're used to looking at survey data, this is kind of a very general way that people have always looked at survey data. So you have this codebook view, which is, our first question is, how would you say your health is? Scale of very good to very bad. And it looks like we maybe have a skip pattern. So usually in codebook views, you have one pipe means you're a skip pattern. So it looks like there's a skip pattern going on. But the codebook views can be, looks like, see here, you have 2 skip patterns in 3. So you're going to have to know how to read those. We've also developed a flowchart view. And we don't have this yet for every study. This is a little time intensive on our part, so we're adding these all the time. But it does take time on our part. So this isn't available for every survey. But you should definitely check if it is, because it's really helpful to understand some of the kind of complicated survey logic that happens in these surveys. And if you're unfamiliar with surveys, so in general, you don't want to have the same question to be asked to all people, because sometimes it's not relevant. So an example of this would be, do you have a pension? And if the person says no, then you don't want to go ask them about a list of 20 questions about their pension, because we know they don't have a pension. And that is frustrating both for the participant and for the interviewer, and makes the survey take really long. So instead we have what we call survey logic, and so you'll just skip to your next set of questions that might be relevant. And so this flowchart view is a really nice way to look at that. So you can see here, we begin our physical health survey for share. It looks like you get a random number generated, which could be a 1 here or something else. If you get a 1 here, you get asked this question. How would you say your health is? Very good, good, fair, bad, or very bad. Right, so it would be asked to, if this is randomly generated, about half of the share sample that way. Or you get this question. Let's see what this is. So this is how would you say your health is, and this is excellent, very good, good, fair, and poor. So the interesting thing you can see about this is that Share kind of wanted to test these 2 different scales for rating your health. And this first one here is considered more of like a World Health Organization scale or just a world scale for self-rated health. And the second one here is the US scale, often referred to as the US scale for self-rated health. And you can see that the US scale has 3 versions of being good. So it's not symmetric. And so one of the questions is, if I'm trying to compare this between surveys, what is, if you are very good, if you're 2 very good on the US scale, are you a very good in this more general scale, or are you a 2 good? How are people answering that question? So that's quite helpful to see that they asked those 2 questions. And then you can also kind of look through You can see we get some more kind of complicated survey logic here. And it's always important to look at survey logic because when you get your data set, often the people who were not asked that question are going to have missing data for a particular question. But it could be that it's missing because, we know that, for instance, with a pension example, that they don't have a pension. So if you're estimating pension wealth, although it seems to be missing for a respondent, you need to be able to look back and say, hey, where was that introductory question about whether you have a pension before they asked their value? And then if we know they were skipped out because they reported they didn't have a pension, then, for instance, depending on what you're looking at, you could assign a 0 value in your data set for pension wealth. So you see this goes all the way through towards the end of the study. And it looks like at the end of the study, we get this random question again. And so it looks like, so the else here was a 2. So if you got a 2 for that random number, then you get asked this question, how would you say your health is? And you get asked the US scale, right? So you get asked the opposite of what you were asked at the beginning. And if you didn't, you had that 1 when you were asked the US scale the first time, then you get asked the European scale. And so they're actually testing 2 things here with Share. So one thing is that they wanted to see, how comparable is this world scale and the US scale. And the other thing is they wanted to see whether there was an effect of being asked this question at the beginning of a physical health module and at the end. So often, if you just ask someone, how are you, at least in the US, everyone says, oh, I'm fine. But if you ask them first, a set of, in this case, let's see, it's the last one, something like 58 questions, is that right? Yeah, 56 questions about how they are doing, how their health is, whether they've been to the doctor, whether they have felt great, any chronic, they go through all the chronic conditions that are possible. Do you wear glasses? What is your eyesight? People are often at the end of that, they're going to answer different, and studies have shown a little bit more negatively. And so one of the ideas is, so how much more negatively, how much is where this question is asked affecting how respondents are answering this question, which is really important. And that's another reason why it's really nice to actually look at the survey and see how things are asked and where they're asked, because that really influences how respondents answer that question. So that is the flowcharts that we have built into the survey. Here is just one other quick example. So this is a common question. This is in Share 2006. So this is ever smoke daily. And if you answer yes, then the next question is, do you smoke now, right? And there's no need to ask that second question if you know someone has never smoked daily. So we've also built interactive graphs and charts. And these graphs and charts are really helpful if you don't have access to the data yet, but you still want to kind of play around. And we kind of want to give you, and we'll talk about how to access that data a little later. But if you kind of want to get to look at, what can be compared, what countries are, what are the measures, then you can use these interactive graphs and charts. And you can see we have certainly not all survey measures, but we have a set of survey measures, and we're going to be expanding these actually in the next month or two, which we think are pretty comparable between different countries. They were asked enough in the same way we could really produce a graph that compares these between different countries. And then you can also filter by age or by gender. So let's look at, if we jump back, let's look at these. So you can click on graphs and tables here. And we have one that pops up automatically, which is currently working for pay. And this is between China, Germany, Japan, England, and the US. So you can see this is the graph. We give you some notes here, and these notes highlight things like that these are population estimates. So we've applied weights to all of these, except in the case of, even in the case of Japan. We've applied weights. We've also, where possible, we've accounted for the complex survey design. So if there was clustering or stratification that happened, we've accounted for those so that if you look at the table view, you can get standard errors which are corrected for that survey design. So both of these for the tables and for the graphs, you can download these. The tables you can download in CSV or PDF, and the graph, using this button, you can download in 4 different formats, or you can just print it. And again, we just kind of wanted to give users an ability to play around with the data to see what is possible here. Maybe this is a first step in seeing whether there is some cross-country variation in something that you're interested in comparing. So let's look at just a couple more of these just for fun. So let's clear out this search, and then let's compare Italy. So this is share country. Let's compare Italy, England. So we'll use ELSA data for that. Japan and United States. So JSTAR and HRS, and we'll compare whether, let's see, we'll pick a year here. Let's pick 2006, and we'll compare. Let's maybe just look at like smoking, which is ever smoked, because maybe we'd expect to see some kind of variation between these 4 different countries. And we can click go. It's going to say processing, and this can take up to 30 seconds. And it looks like in this case, it actually might take up to 30 seconds. If a graph, this is the first time a graph has been generated, it will take around 30 seconds for that graph to be generated. If the graph has been generated before, it pops up automatically. So it basically just depends on how recently the data has been updated and whether someone has been searching for a similar thing that you've been searching for how long it takes. But they shouldn't really take up to more than 30 seconds. We can look through, while this is loading, we can look through some of the other possible. So we have demographics. You can compare age, gender, marital status. We have a whole list of health variables, which include different chronic conditions, depressive symptom scores, which is CESD here, and physical functioning, so ADL summaries or IADL summaries, healthcare, cognition, employment history, also financial and housing wealth, things like a common one is just total family wealth. But also we break that out into different parts. So what is the value of the primary residence, which can be interesting, or income, which is individual earnings, individual income from public pensions, total family income, and then family structure. And we just have 2 currently. I think this is one of those that we're going to be expanding in the next couple of months here, which is number of people living in the household and number of living children. And you can filter those by age. So in this case, for this question, currently working for pay, you can see we filtered by 55 to 64, which makes sense, right? Because you are interested here probably in comparing people who would be of retirement age. You can also click off of this, and that would just compare everyone. Let me restart that. It popped up quite quick. So this is ever smoked. Between our 4 countries, you can see that England and the US are pretty high. England's a little higher than the US, than Japan and Italy, which is interesting. One of the things you might want to look at, so is that different? Ever smoked is a kind of a different measure than smokes now. So if you look at smokes now, when we go back to our chart, you can actually see that Italy and Japan have a greater percentage of people who identify in their age brackets who identify as ever smokes now, and less than England and the US, which are, as is typical, very close to each other. So that's interesting. And then you could also break this out if we select just one country. So let's look at just England, so just that ELSA data, and we'll stay in 2006. Just 2006 for this. You can also you can compare across subpopulations if you're only looking at one country. So for instance, we could see if there's anything gendered about this response. So we can click on gender here. So we can see in England that it looks like 15% of males. I think we jump back to our old graph there. 15% of males said that they smoke now, whereas it's basically exactly the same between England. And we could jump to our table for male and female. So we've got 15% for male, 15.49, and we can see our standard error. So those are probably exactly the same. The other thing that the table will tell you, which can be helpful, is whether there are missing values whether for whatever reason we're just missing some people who should be included in this. So you can see we've got a couple missing people here, which is super low for ELSA, but could be larger if there was more item non-response for a certain question. And again, you can download both the graphs or the tables. So let's look at just a couple more examples that are kind of pre-generated here. So this is, again, our currently working for pay, but I've added in Slovenia here. So you can see that you get a lot of cross-country variation with Slovenia, being less than 25% of Slovenia in share. So that's 50 and older, or in this case, between 55 and 64, as we've set this filter here, who are currently working, compared to a country like Sweden. We see a lot of people still working between the ages of 55 and 64. Here's an example where we graph a continuous variable. So this is one of our income variables. The graph would look similar for a wealth variable. And so this is a histogram. We've looked over 3 different age groups. So we've said 55 to 64, 65 to 74, 75 to 84, plot those separately. And you can see that the distribution of income really does change between these age categories, which is what you would expect, right? As people enter into retirement, and their, maybe their earnings are moving away from earnings. Their income is moving away from earnings and more towards something like pension or retirement accounts. And here's an example over a different set of years. So this is the net value of primary residence in the U.S., and we've compared it between 2000 and 2010. This is using HRS data, and you can see, looking both at the median and the mean, that housing prices generally continued to increase until 2006. They dip a little bit in 2008, and then by the 2000 interview, they're really, they're just a fraction. They are pre-2000 levels, which in the median, and I guess using the mean, they're somewhere around maybe 2002 levels. So that has a lot of effect on how people. This is people's wealth. This is a wealth measure, and a lot of people in the U.S. especially use homeownership as well. So you can see this kind of cross-country variation, which is a result of the housing crisis here in the U.S. So everything that I've showed you so far, you do not have to be a registered user of the of our website to use. So any of this, anyone can go on, but you definitely should register to use our site. And everything that we do kind of past will require that you have a profile on our site, and you'll understand the reasons for that shortly. But let's look at how to register. So if we jump back to the to our site, the login or the register button is right here at the top. If we click on register, registration is very simple. It's just this form. So you just have to tell us the most basic information about yourself, who you're affiliated with, what university or research institution you're affiliated with, and you make a password. And then you will send we'll send you an email just to confirm. And then once you've confirmed that that is your correct email, you'll have access. So let me go ahead and log in here. All right, yeah, so you can see if we jump back here. So this is Jane. She is our kind of example account. And you can see that a couple new things happen here. So you have an item card. So that's where you can collect items. And we've got a couple of things in our item card, and we'll talk about that more a little later. But we're registered. You can see now our item card is empty, which if you just signed in for the first time and haven't used the website, this is probably how you're seeing the site also. So let's talk about integration with data, because this is one of those things where having a profile is really helpful. So let's say you're interested in, let's say you have the health and retirement survey data set. So you've gone, in this case, to the University of Michigan, and I'll talk briefly more about where you obtain all these data sets. So let's say, but you've gone to the University of Michigan, you have downloaded this data, and it's on your computer. And then you use our site, the Gateway to Global Aging Data, to find whatever survey items that you're interested in using the HRS data for. And then using Stata, which, if you're not familiar, is a statistical analysis package similar to SAS or SPSS, or R in some cases. We will generate a stated data set for you. So basically what we do is, we have those variable names there. So if you say, I'm interested in comparing, these 7 questions, in this case in the HRS, we will generate a stated file for you, which will take your data set and will transform it to just having those variables which you were interested in, which can be extremely helpful, because so even for the HRS is distributed 1 data set per module. So if you're pulling in questions from different modules, there's going to be actually a lot of kind of very root, often very boring to write data code to merge and pull it in, or append if you're using a different wave, the data set that you want. So we kind of create this stated data set for you automatically. It's quite helpful. One of the things we want to do is remove some of these barriers to people getting involved in using this data. So that's how we do that. I will say, for people who aren't data users, we've had a lot of people ask for SAS and SPSS integration, and it is on our long-term plan to add that, but that is maybe 2 to 3 years out. So apologies if you were not a Stata user. The good news, though, is that if you have access to Stata, you can use our website to create a Stata data set in which you have to write 0 Stata code, and then you could transfer that data set into a SAS or SPSS data set and continue as you normally would with your research. So we use the data options page, and that's kind of your profile page, to generate these do files. So let's just look at that. That's right here under this item cart. We have our data options page. So you can see 2 things here. One is a prepend do file, and you can use this area to list any Stata commands you would like to place at the top of any generated do file. And a do file is a Stata program. That's the extension for a Stata program. And you can see preloaded here. This is for everyone. We give a couple that just to kind of make sure we have enough memory, and that we kind of have these environmental variables set for Stata. And then the other thing is these data folder locations. So you can see for a lot of data sets here, ELSA 2002, ELSA 2006, I've said basically that hey, I have this data set, and here is where it's located on my machine. So for instance, if you got a new data set, let's say I got the Charles, the Chinese data pilot in, I could say, hey, on my machine, I have this located in C drive Charles, folder called pilot, and a folder called data. And then I could add that. So that anytime that I want to use that I'm looking through the Charles survey, and I can add these to my cart, we will produce for you a Stata do file, which automatically knows where that is on your computer, so you're not going through and adding these folder names for every different data set. And again, the idea here is just to remove some of this really boring, really routine root programming, so that you can just start using your data and start doing analysis to remove some of those barriers. So let's talk about what it means to create an analysis. Create analysis data. So you can create a collection of survey items which are specific to your research using your item cart. You can search for relevant survey items. You can browse by surveys for relevant survey items. You can browse by topic for relevant harmonized survey items. I'll show you all this. Or you can use predefined carts. So we've seen some of this before, right? So we saw, this is kind of what we consider browsing. So you could browse through if you're familiar with the survey. In the modules, you go in here, and this is the income and asset module, and you could say, for any of these, you could say, let's add this to our cart, and you can do that a couple ways. You can see now that I'm logged in, I have these 2 extra columns, and one is in cart question mark, and one is data status. And you can see that I've got a checkbox, which just means that I have indicated the location of this data set. If I hadn't, I could click on this to say, hey, I have this data, here's where it is, and then I could add any one of these to a cart just by clicking this. You can see as that happens, I'm getting more items in my cart. So I've got 6 items now. Or I can just click these off, and I'll go back to having 0 items in my cart. And I'll briefly let's click on Create Analysis Data. And the other thing that I want to show you, so you can search for them. That would be using the Concordance. You can browse them. We also have predefined carts, and these are for what we consider our harmonized data sets, which we'll talk about later, and I'll show you an example. But those are our harmonized data sets. But what if you don't have your data yet, right? Like what if you're interested in using ELSA data? And so in this case, we don't distribute ELSA data. So you're saying, hey, where can I obtain this? So that is our download tab. So this is download data and more. So you can see we have all the studies used here. We provide you a link to download the survey data. Usually it's quite easy to download. And again, in general, it's easy. They're always free if you're doing research. Some of them are quite quick, like the same day you'll get a confirmation email. Once you usually have to enter in some basic information about why you're doing your research, what you hope to find in maybe your affiliated research institution or university. And you can also, we'll talk about this later, but these last three columns here apply to our harmonized data sets. And so we'll talk about that. And then you also can see we have links here to our working papers. So we talked about those, chronic conditions, financial transfers, expectations. And then we've also got recent presentations. And this is where you can come to find these slides in the video for the webinar. I'll probably have those up by tomorrow morning. So let's go through an example where we create an analysis data cart. So let's make a, let's take an example. So let's say we want to compare whether health limits any paid work in 2006 between the US and England. So we can select variables from the HRS for the US and ELSA for England. We have to make sure we have those file locations listed. We'll create a cart. We can download a do file, which the gateway will download for you. And the result is going to be one data set with information from two studies without any extraneous variables. So let's actually just do that. Let's just go through it. So let's say we don't know the surveys really well. We don't want to look through all of the modules. So let's just use a search. So we can type in health limits paid work, and we want to filter for the HRS and ELSA, and we're interested in 2006, right? That was kind of our interest question. And then we can go search. So you can see we've got these questions here. So this is whether health limits paid work, item label is HELWK. For any of these, we could click into it to just get more information here. So yeah, this is exactly the question I write, whether your health limits your paid work. And so we can click add to cart right there. If we jump back to our search, you can also just click on and off from here. So that's for ELSA, and then let's look for the HRS. So the HRS, let's see, this is whether health affects paid work, and this question is actually asked twice in the HRS. They had one module for people with disability and one module without. And so let's add both of those. And then we can go to our cart. You can see here our data status indicates that we have the location of both of these data sets, so that's great. We don't have to do anything here. And carts are also nice because we can save a cart. So let's say I just want to save this right now and say health limits work, US, England, 2006. Right? It's a pretty small cart, but we'll just save it. And that means if you're working on a couple of different research projects, you don't want to lose kind of these combinations of questions or survey items, you can save it and come back to it. What it also means is that you can add some other cards. So I've got an HRS 2006 basic demographics cart, and you can append. So let's just append this. So let's see, we add two variables, a gender and a birth year variable. And let's do the same for ELSA. These are two that I made before. You'll also see here is where we have these base cards that I talked about a little earlier, and these are for the harmonized data sets, which we will briefly get into. So I've got these. We can go select all. We can click create.do file. And you could run this directly with Stata, or in this case, I'm just going to open with WordPad so you can just see what's happening. Let me make that a little bigger. And in this case, it's a couple of variables, and so the code is quite clear. But we get in our Stata code, we get prepend.do file, those things. We say it knows the ELSA 2006 data is named Wave 3 Core Data Phase 2 version 2. These are the variables we're going to keep from it. You can see we've got, this is our gender, our birth year, our work status, and we also always leave in the identification variables. So this is the unique identifier, this is the household identifier, and this is the person identifier. And we never take those out because we want you to always be able to, on your own, perhaps, to merge back in with other data. So we do that, and then we append using some HRS data, this first data set and this last data set. It looks like we use 3 different HRS data sets. And as I said, HRS is one of these surveys that distributes each, even though we have only 4 HRS variables, they are in 3 different data sets here. So we've combined all of these into one. So as I said, you probably don't want to open this to WordPad, but you can run this directly in Stata, and because you've told in your profile where these data are located, it'll run automatically. So let's just look at, if you ran that in Stata, what your data set would look like. So this is the kind of the breakpoint right between the HRS data, which would be up here, and the ELSA data, which would be right here. So you can see we've got our identifiers. We've got this is that KM002, our question of health limits paid work. You've got 1s or 5s here. And then again, for our ELSA data, we've got our identifiers, and then we've got this question of HELWK, which was its name in the ELSA data set. And it looks like they've got value labels applied. So we've got knows, don't knows, not applies. So we've cut out a lot of work for you. So at this point, we've combined multiple variables from different data sets for you. You've got it all right here, and you can start your analysis. But you can see that there's still different things that are happening, right? So one of the things that you might notice is that the information that we're really interested in comparing is KM002 and HELWK, right? And these are maybe formatted differently. So you can see we've got 1s and 5s in the HRS data, and then we've in the ELSA data we've got value labels, and in ELSA actually the value labels are a 0 and 1. So we've still got these differences because the data are stored differently and our variable names are named differently. And that is kind of the reason that we wanted to kind of go one step further, which is why we built the harmonized data set, which I've been mentioning. And so let's talk about these harmonized data sets. So harmonized data sets are created to provide harmonized measures of international aging and retirement studies. And harmonized data sets define variables as similarly as possible to the RAND-HRS definition of that variable. And if you're not familiar with the RAND-HRS is a version of the HRS, the Health and Retirement Survey here in the US, a version of that data set, which is produced by the RAND Corporation, which is very user-friendly and is by far how the majority of people use the HRS data, which actually comes from the University of Michigan. And so that kind of being our basis for comparison, because it's the most frequently way people use HRS data, we try to stick with that, and it's very user-friendly. So one of the things is that it's structured in a FAB format. So every individual is one record, and then multiple waves of information are listed out using different variable names. So it means for the RAND-HRS, it is one data set for the entire 12 waves of the HRS data that you download, which is really nice. And it doesn't have none of the harmonized data sets include all of the items in the original survey, but they include the ones that are most frequently used. And in the case of the harmonized data sets, is the ones that are most comparable between different countries. So I mentioned those variable names. So we try to use we use variable names which are the same if the measure is comparable. And their variable names are easy to understand. They all follow kind of a similar format. So a variable called R1 work is whether the respondent is currently working on wave 1. So R for respondent, 1 for wave 1, and work because it captures whether they're currently working. And then variable names also indicate how similar to the RAND-HRS definition of a variable is. So for instance, in the ELSA data, if you have a variable called R6 work, or not R6, in this case R1 work, then you can know that it's really comparable because we've given it the same variable name. But we also might have a variable called r1work_e for ELSA, and that means although it's capturing whether the person is currently working, like it's a similar concept, it could be that it's not exactly comparable, so we didn't want to give it exactly that same variable name. And in the case that they're not, maybe they capture a kind of similar domain, but they're not really comparable at all, we would not give it even the same variable string. We would change this to be work something else. Then we also include spouse versions of most variables. So for instance, a variable named s2work is whether the respondent spouse in wave 2 is currently working in wave 2. And that's helpful if you're looking at family effects. So these are the currently available harmonized data sets which we produce. So this includes the harmonized ELSA, includes the first 5 waves of ELSA, the harmonized share, which incorporates the first, second, and fourth wave of share, the harmonized JSTAR, which incorporates the first 3 waves of JSTAR, the harmonized CLOSA, which incorporates the first 4 waves of CLOSA, so 2006, 2012, harmonized LASI, which is just the pilot data currently of LASI, the harmonized Charles, which is wave 1 and wave 2 of Charles, and then currently we're also working on harmonized MHAS for Mexico, harmonized Corrales for Costa Rica, and harmonized tilde for Ireland. And those are partially, the MHAS, harmonized MHAS and harmonized tilde are currently partially available, and we'll be expanding those over the next year. And these harmonized data files are either distributed through the gateway, through our site, or by the originating study. And in some cases, the data files are created by the user based on a code provided by the gateway. So let's just look at those in this site. So again, you'll go back to this download tab, download data and more tab. And then you can see here are 3 columns for harmonized data. So you can download the harmonized data set, and in certain cases, like for the RAIN-HRS or for the harmonized ELSA, that will direct you back to, in this case, ELSA or the UK data service. And then in some cases, it'll say see data code below. And in that case, we provide, well, in all cases, we provide this data code that was used to generate those. And that's nice if we've done something programming-wise that you're wondering what we're doing. We make everything accessible that we do because we want to be transparent about how we've gone about our work. So we provide all of our programming for you, and we also provide code books, which are right here. I will say there is one exception to all of this, which is LASI, and we are one of the partners for the LASI survey, so you can actually download the original LASI data or the harmonized LASI data directly from our website, and it's really fast and easy. India is a fascinating, interesting country, so I would encourage everyone also to use that India data through the LASI survey, which is available to download from our own website. So let me just walk through a brief example of what harmonization is. So this is a simple example of harmonization. So this is Share 2004, and this is the questions about smoking. And let's say we want to make a variable which captures whether the respondent smokes now. So there's a little bit of a skip pattern in Share. So you get asked this first question, which is ever smoke daily, yes or no. If you answered yes, you get asked this second question. But we want to make this harmonized variable, and we're going to give it a variable name which is easy to understand. So it's a respondent level variable. It's wave 1 of Share because it's 2004, and we're going to our variable string is smoke in, which is smoke now. So one of the things that we do is we account for skip pattern. So we assign, everyone who said that they don't smoke daily is going to have a no for they don't smoke now. Someone who said they never smoke daily has a no. And then anyone who said that, I smoke daily, but I don't now also has a no. And then for those people who said that they have smoked daily and they are at the current time, they have a 1 as a yes. And in all of the harmonized data sets, we always try to use the same value codes. So a 0 is always a no, a 1 is always a yes. And that's consistent through all studies. So it's a really simple example. We're using 2 variables and not doing a lot. But I also want to show you kind of a complicated example because there's a lot that goes into it. So this is JSTAR is our Japanese survey. This is their 2007 wave. It was asked in two different parts. So there was a self-completion, like something that was mailed to respondents to complete first and mail back. And then based on those answers, when the interviewer came to your house, which is usually our core interviewer is called a CAPI, which is a computer-assisted program. Then you get asked a set of questions which reflect your self-completion answers before, basically. So let's say we're interested in making a value which captures, a variable which captures household value of savings. Which savings is just going to be one part of a wealth portfolio. But let's say you're just interested in how much this household has in savings, traditional like checking or savings accounts. So to do this, you're going to have to go through each step of JSTAR to be able to say, hey, if someone doesn't have any savings, we'll give them a 0 for that value. If they do have savings, we will assign them that value, the value they report. And in this case, JSTAR is only interviews one person, and they're reporting both for their spouse, and themselves. And in the self-completion survey, that first survey that people get mailed, they answer those separately. And in the CAPI survey, they answer those together. So that's really important to remember. Also, in the CAPI survey, if they kept your funds separately, then it's just going to be missing. And then one of the things that you see is we have these three questions here, which are our unfolding bracket questions. So if someone says that they do have savings, but they don't know how much it is, then you get asked these three questions, which are, did you have more or less than blank yen in savings? And then based on that answer, you get asked another question. And this is blank here because they actually, in JSTAR, they allowed the interviewer to kind of choose these. And I think the idea is, you would look around and say, do I want to start at 100 yen or 1,000 yen? So for instance, an interviewer could say, hey, do you have more or less than 50 yen? You don't know how much you have in your checking account, but is it more than 50 yen or less than 50 yen? And if the person says that it's more than 50 yen, then you could say, okay, well, is it more than 100 yen? And if they say yes, then you could say, well, is it more or less than 200 yen? And they could say no. So then we know that that missing value is between 50 and 100. And then we can do a much better imputation. So we do provide imputations. In the case of JSTAR, we actually do the imputations ourselves. For a lot of the surveys, they also impute their own missing values, and we just use those values. So basically, we go through and we try to do it in a way that will not bias your results, but allow you to still include that respondent. We assign them a value, and then we include lots of flags to tell you where that value was assigned or it was reported, and how we obtain that. And how we communicate those is through our harmonized codebooks. So each harmonized codebook, each harmonized dataset is accompanied by its own codebook. And so this codebook includes a brief overview of statistics for each variable. We detail the variable creation and any assumptions made in that creation. We highlight any differences between this harmonized variable and other harmonized variables. And we list all the variables from the originating dataset using the creation of the variable. So let's look at what that looks like. So this is our simple example. This is from the harmonized share codebook. We have two smoking measures which we record. These are the ones that we graphed earlier, which is smoke ever or smoke now. We can see that we have both respondent and spouse for both of these, and these are categorical. We include some brief descriptive statistics, and these are descriptive statistics to give you an idea of what how these values are distributed in the data set. These are not population estimates. But you can see things here like, okay, so it's between a 0 or a 1, and you get a mean and you get a number here, which can be helpful. And then because they're categorical, we also kind of we give you the frequencies here for each of those categories. One of the things you'll also see is that we use special missing values, which are used by SAS and Stata to kind of give you an idea. It's a missing value, but it's a missing value with more information. So for instance, we had two people who said that they don't know in wave 1 whether they have smoked ever. And so we code that as a .d. And so instead of just having it missing, that anyone with the .d says don't know, which is different from people who refused to answer. So we had 10 people who said, I'm not going to answer that question for whatever reason. Maybe they didn't feel comfortable answering that question. And then you can see we have our 0 for no and 1 for yes, which will always be the case. We have a text here about how constructed. So we say RW smoke ev indicates whether the respondent reports ever having smoked daily for a period of at least 1 year. The answer to the respondent's first ever daily smoke question is carried forward in subsequent waves. So there's also skip patterns that happen between different waves, right? If you've answered something in an earlier wave, you might change the questions you get asked in a later wave. So we account for things like that here. We let you know what the codes are, what the missing values are. We highlight any cross-wave differences, so if the question changed between different waves of share, which can be important. And then, because what we really want to do here is encourage cross-national comparison, we always use kind of the RAIN HRS as our basis for a comparison, and so we highlight any differences between this version and the RAIN HRS version. So here we say, in share, respondents are asked whether they've ever smoked daily for a period of at least 1 year. In the HRS, respondents are asked whether they've ever smoked, regardless of whether the smoking was daily, and not given a definitive period. So there is some difference. And in this case, we've used the same variable name convention that is used in the HRS of smoke ev and smoke in, because we think that they're really pretty comparable. If we didn't, we might have done smoke ev underscore e here to mean that it's ELSA, or share underscore s for share specific. But we thought they're pretty comparable. But it's really important to note what is being captured and if there are differences, right? Because the difference here is whether it was daily and not given at a definitive period. So, if you're looking at a health outcome, which you only expect to occur from like daily smoking for a lot of years, right? Then this distinction might be important versus whether you're just trying to capture something maybe behavioral about risk-taking or views about health behaviors. The last thing we do is we list those share variables used. So in this case, it's really simple, as we saw in that skip pattern. We list these because if, let's say, you disagree with kind of how we harmonize these two variables, and we just kind of want to give you, we try to be transparent about everything that we do, so we give you the variables that we use. So if you want to make a different decisions or different assumptions in your harmonization, that you're able to do that. And again, you can also download all of our programming, so you can see, you could go to this variable creation point in your code and say, hey, I want to change it a little bit. And then we'll look briefly just at this value for our complicated example. So this is from the Harmonized JSTAR codebook. This is the value of savings. And the value of savings is probably, if you're not an economist and you're not particularly interested in savings versus just like all of, total family wealth, you're not, you just want total family wealth, but total family wealth, is a combination, of 12 different types of assets, which would go into wealth. And there's a lot of programming that goes behind this. So, to build kind of a full family or household wealth portfolio, takes, I don't know, depending on the survey, anywhere between 3 to 6 months to maybe even a year for certain complicated. JSTAR is a particularly complicated one. 3 to 6 months to a year of programming. And so we really try to cut a lot of that programming out for you. If one, you're not, let's say you're not an economist, you're not really interested in looking at different components of wealth, and you're not interested certainly in creating a whole wealth portfolio measure. Really what you're interested in is volunteerism, and you want to see, whether the amount of family wealth someone has contributes to how much they volunteer. So you can just add this variable in, knowing that economists have created this variable, and we provided you all the information about how we've created it. So in this case, so you can see we provide first here is our value variable, and then we also have flags, which are important. And here are how our flags are broken down. So we tell you how that value was obtained. So a value of 1 means it's a continuous value, so it was reported. So in these cases, the person said, I have a savings account. This is how much it is in it. We also have kind of 3 bracketed, or we have a complete bracket, which means that it was imputed. So we assigned it a value, but we assigned it knowing that it was between, for instance, 50 and 100 yen. We can also have an incomplete bracket, which means we assigned it only knowing one side of that, right? So we knew that it was more than 200 yen, but we got to the third question, and there's only 3 questions that the interviewer asks in these unfolding brackets. And so we assign a value in an unbiased way that won't bias your results where it's more than 200. We can have no value or bracket, meaning we don't know anything. Maybe they said I don't know to all of the unfolding bracket questions, and then we still assign a value. But again, there's different levels of certainty for all of these. So if you're interested in only looking at reported values, you could do that. For all of these no assets, this is the person said I don't have a savings account. And these people are all assigned a 0 based on that previous answer. There's also people who said I don't know whether I have an asset. Those are also imputed, right? This is like a different level of imputation, a different level of assumption. So those are don't know. And then JSTOR also top-coded values. So in the most publicly available JSTOR data, they top-code values so they don't identify people. And so we also flag any value that is top-coded because you might want to watch out for those. We provide a lot of information about how this variable was constructed. Again, it goes on for a while. We talk about the top coding. We also talk about how we imputed, what were the assumptions we made in imputing. And then we list all of the variables that were used also. And again, there's a lot more variables used in this case. So let's look at an example, another analysis example, but using harmonized data. And we can see kind of what are some of the benefits of using harmonized data. So say we want to compare whether any health limits paid work in 2006 between the US. So we're going to go back to that original question, but this time we're going to use harmonized data. So we're going to select variables from the RAND-HRS and the harmonized ELSA, and variables we know are going to have a similar naming convention. And we're going to download our do file, and the result is going to be one data set with easily comparable and similarly named measures from the 2 studies. So let's go back to our website, and we've got some things in our cart right now. And we could save those as own cart, but I know I already have those saved, so we can just remove from that cart. And let's use our concordance. Our concordance here. So we could search for these items. We could search for health limits paid work for RAND-HRS, HRS, or for ELSA. You can also browse through. You can go to like RAND-HRS here. We could go to health, and we could search for on this page health limits paid work, and we could find that, or we could use the concordance to kind of search through. We can do it different ways. In this case, because we're getting close to where I want a lot of people to be able to answer questions at the end. You can see that I've got some cards already saved, and I've already saved this card. So we have harmonized health limits work US England. So let's load that. So you can see we have our 2 variables. We have R3 health limits work. Again, we try to make these variable names like easy to understand. And here we've selected wave 3, which is 2006 of ELSA, and wave 8 of HRS, which is 2006 of HRS. And in this case, we can also use our base cards. So we have a harmonized ELSA base card, so we can append that to our current card. And so this gives us a lot of variables. These are interview status variables and whether the person was in the wave. And we can do the same for the RAND-HRS. We can append that card. And again, this gives us this gives us a lot here. There's a lot of ways of HRS, interview status variables and weight variables, age and gender variables, kind of the most basically used variables, which are often just nice to kind of throw in there under the assumption that eventually we'll use it. So then we could select all and create a do file. We could run directly in Stata. And in this case, we will let's just look at what our data set will look like. So this is our data set. One of the things that we do is we assign a country name and a survey name. So here again, we're at the breakpoint between the HRS and the ELSA data. And you can see these are our unique identifiers. We always keep those. And in this case, I've renamed this variable to be R06 health limits work. And you can see, this is one variable. We've got it in one column now. The same value labels are applied here, and a 0 is a 1. I mean, a 0 is a no and a 1 is a yes. So we've cut out a lot of that work that you saw from our earlier example. So for those, if you're interested in using survey measures, I would always check whether they are included in a harmonized data set, because there's so much work that's gone into, years, literally years of programming. We have a team of programmers here who have gone through and programmed a lot of this stuff for you so that you're not repeating this programming, and we've documented everything for you. And then the last thing briefly that I'm going to talk about is our literature search. So users can find publications based on health and retirement surveys around the world which are relevant to their research focus. You can select from survey, topic, or year. You can search by title, author, and source. All results are linked to Google Scholar, and you can export citation information as a text, CSV, or EndNote file. So let's jump back to our site and let's look at this. So this is the publications. This is that last tab that we have not talked about. So you can see if we scroll down here. So currently we've got over 5,000 different publications which have data from based on one of these health and retirement surveys, this International Family of Health and Retirement Surveys. And for instance, if you're interested in just using one survey, like just for instance using Charles, you could click Charles and automatically you're going to get Charles surveys which are just using Charles. You can also go to select all. You can search by title. So for instance, you could search just studies that have the word health, or maybe something less general like cognition. You can search by author. So for instance, we could search by Crimmins, who is a researcher also here at USC who has worked with a lot of these data. You can search by source. We include the journal, the year that it was published, or by topic. So for instance, you could search for cognition as in the title, but we've assigned topics to most of these, I think all of these. So you can just click cognition. We're going to get cognition papers. So we could say, hey, cognition papers, using HRS. So here are cognition papers using HRS. And then for any of these, we include a link to where they are on Google Scholar. And if we can provide a link to the direct paper, we'll also provide that for you. But you can have these. And then for any of these that you select, so let's say so we select, these are the ones that are important to us. You can then go down and you can export as a text, CSV, or EndNote file, as I mentioned. So this is really helpful if you're interested in just getting started in a particular domain. I would say, if you're interested in cognition, look at whether there's a working paper that we already have, on our downloads page. Here are our papers. So we do have a cognition paper. You could look across surveys. You could say I'm interested in these three. Using cognition, what are the survey questions or what are the years that I could compare? That's a helpful thing to do. And then you can also search for publications. So we've really tried to provide as many tools for people who are interested in using these data sets to do as much research as possible, kind of in one place. We want to be kind of a central place for you to compare, these different surveys and to really explore, because they're long. These surveys are long, and as you've seen, they're multidisciplinary, and they can change between waves. And some of them are long in that they have multiple waves. So there's a lot of things to take into account, but there's such a wealth of topics for consideration and for research. I'll briefly also just show you our help page. So some of the basic things that I've gone over today, you can also find on our help page, such as instructions for searching for a relevant survey item, or browsing, or saving your cart, creating an analysis data set. And then you can also, we'll have a link here to our webinar shortly, to this webinar. This is for our last webinar. And then we also maintain a help desk email, which is help@g2aging.org. And you can email us at any time. We're a team of programmers and researchers. And so you can email us and we'll farm your question out to the right person. And we always try to answer back within 24 hours. So that can be something as simple as, hey, for whatever reason, I'm not getting my registration email, to, hey, I'm interested in looking at volunteerism in these different countries. Can you help me? What years I can compare. So any of those questions, you're welcome to ask us. and we'll answer you back within 24 hours. So I think that that about wraps up this webinar. Again, you can contact us at help@g2aging.org if you have any other questions. And then I'll also just make sure to open the chat now and make sure anyone has questions. If anyone has any questions right now, this would be a great time to ask your questions to me using the questions or raising your hand, and I'll unmute you and you can ask a question. But for everyone else, thank you so much for joining us, whether it was 8 a.m. here on the American West Coast for you, or whether it could be quite late for you in Europe. Thank you for joining us, and please, use our site and let us know, what you're doing with this research. We're excited. So thank you very much, and I'll hang out here for about 10 minutes to answer questions.